Welcome to this instructional video on intramedullary nailing of a tibia fracture. Here we see extreme fractures of the lower leg. This procedure will stabilize a broken tibia using a metal rod and screws to help the bone heal in proper alignment. This will help patients get moving and walking quicker. During this video, we will walk through the steps performed by our surgical team. Due to high energy forces during an accident, we commonly see open fractures of the tibia. Given the open nature of the injury, the bone and tissues are contaminated and need a thorough debridement and washing to minimize infection risks. Once a preliminary irrigation of the wound is performed, we begin with an incision just above the patella of the knee and enter into the knee joint. After the incision, we bluntly dissect through tissue to create an opening that will allow us to place a cannulated drill guide to protect tendons, cartilage, and skin. With that in place, we position a guide pin through the cannula at the top portion of the tibia. Using a C-arm fluoroscopy machine, we take radiographic images to assess our trajectory with the guide pin. If we like our path on the front view and the side view, we power the pin into the bone to hold our position. Now, directly over the guide pin, we use a drill to create a large opening in the tibia. With that opening created, we insert a much longer guide wire that will go from the top of the tibia all the way down to the end of the bone. We use the C-arm to get more x-rays to confirm the placement of this wire. If the wire is positioned correctly, we now use a measuring device to assess the length of the bone as we prepare the appropriately sized nail for implantation. Once the length of the tibia is measured, we prepare the rest of the bone to receive the rod. Just like we created a large opening with the drill at the top of the tibia, we now use a series of reamers to sequentially create space in the marrow of the bone. With each pass down the tibia, the size of the reamer increases. During this process, we can visually see on X-ray and physically feel the resistance on the reamers for us to judge the appropriate diameter of the actual implant inserted into the bone. With the length and diameter of the tibia determined, we now implant the rod over the guide wire with a mallet. To hold the fracture site reduced in proper alignment, we often use a clamp. However, some open fractures allow us to manually hold the fracture in place. Due to missing bone during this surgery, we can see the rod being inserted inside the bone, which gives an incredible view that we don't often see. Once the rod is implanted, we make small incisions near the ankle. The tibial nail is engineered with holes so that we can drill from one end of the bone, through the rod, and out the other end of the bone to place screws for further fixation. Using the C-arm for guidance, we drill the bone and use a depth gauge to determine the length of screw needed. This process is repeated for the second screw. Up near the knee, we connect a targeting arm directly to the rod so that we can insert another screw. The purpose of all these screws are to prevent the rod from subsiding, pivoting, or shifting as the fracture heals. As we did near the ankle, we drill, measure, and insert the screw. Once all hardware is implanted, we detach the insertion handle and move to the final phase of surgery, which includes washing the incisions and wounds with sterile saline and closing the skin with sutures. As we close the wounds, we use a strong dissolvable suture to approximate the deeper layers of subcutaneous tissue. The closing process is meticulous to ensure that the skin heals properly, which reduces risks of infection. The most superficial layer of skin is then closed with nylon suture. This allows for a tight closure while also giving more compliance to the skin with the swelling that is expected to happen. With the incisions closed, we clean the leg and apply sterile dressings. This concludes the surgery for intramedullary nailing of a tibia fracture. This operation takes 30 to 60 minutes. It is an amazing process to take an obvious deformity and effectively correct it. While patient circumstances vary, most will be given full clearance to begin working with physical therapy teams without restriction.